What are the pros and cons of Medicare Supplement Plan G? That's what we're going to talk about in today's video. So thanks for joining me here on this video. My name is Jamie from meetjamie.com. I'm an independent insurance broker. I help people all over the country understand how the Medicare program works and also help them find the coverage that fits their needs. If you have any questions, you can reach out to me at my website, meetjamie.com. So let's talk today about the pros and cons for Medicare Supplement Plan G. We're going to dive right into the video today, and we're going to talk about number one, the pro of Medicare Supplement Plan G is its comprehensive coverage. It used to be that Medicare Supplement Plan F was known as the most comprehensive Medicare supplement plan that you could purchase. For many people who are eligible after 2020, January of 2020, for Medicare, they were no longer able to purchase Plan F. And so Plan G became very popular. And the reason is because of the gaps that it covers for original Medicare. This includes things like inpatient hospital stays, doctor visit copays, medical tests, and even preventative care. The other great thing is that it also provided some additional skilled nursing facility care insurance. And so it's very, very popular, and it even has some outside of the country emergency care coverage. And so it's a very popular plan. The second pro is that it has lower out-of-pocket costs. Now, when I say out-of-pocket costs, what I mean is there are some supplement plans out there where the cost is shared between you and the company. For instance, I'll just give you an example. Medicare Supplement Plan N has some co-payments if you go to the doctor or emergency room, whereas with Plan G, you don't have those co-payments. Really, the only out-of-pocket expense that you'll have is your Part B deductible. And in 2023, that deductible is $226. And so if you're looking to get a plan that, hey, this is going to just take care of my 20% gap left over from original Medicare, this is one of the reasons that many people choose Medicare Supplement Plan G. Another big plus to Medicare Supplement Plan G, and this is the case with all Medicare supplement plans, but you don't have any network restrictions. In other words, you can go anywhere in the country that accepts original Medicare. And so you just show up, you have your Medicare card, you have your Plan G card, and you are good to go. And so there's a lot of flexibility. A lot of the people that I help get a Plan G, one of the biggest questions I ask them is, do you travel? Do you like to travel? Maybe they RV, camp, or just are snowbirds. Then Plan G is a great option. All right, so let's talk about some of the cons of Medicare Supplement Plan G, and that is you will pay a higher monthly premium because it is comprehensive. And so if you compare it to other Medicare supplement plans, or if you compare it to a Medicare Advantage plan, you are going to pay a higher monthly premium. But what you're paying for is a lower amount of out-of-pocket costs. And so that's just something to consider, because sometimes the out-of-pocket costs and comprehensive coverage may offset the higher premium costs. There's no way to predict the future. That's just the way that it is. You don't know what your health will be a month, 3 months, 6 months from now. But if you're looking for something that locks you into that comprehensive coverage, just remember you are going to pay a higher monthly premium. Again, we already mentioned this, but the Part B annual deductible is not covered, so you will have to pay that out of pocket. That's another con. A lot of people don't know this, but Medicare Supplement Plan G is not available in every state. So this is why it's important to work with a broker or an agent to check with them not only about the costs of Medicare Supplement Plan G, but even to make sure that it's available. And then the last con that I'll say about Medicare Supplement Plan G, again, is like other Medicare supplement plans or original Medicare, and that is it does not provide prescription drug coverage. So if you choose to purchase a Medicare Supplement Plan G, you're going to want to make sure that you also purchase a prescription drug plan, a Part D prescription drug plan. And those can be as low as $5, $6, $7 a month, all the way up to $50 a month. So it's important to, again, work with a broker, make sure that your drugs are covered and that you're good to go on that front. The bottom line is this: Medicare Supplement Plan G is a great policy for people who are looking for comprehensive coverage for the 20% gap that is left over from original Medicare. Regardless of how you choose to get your Medicare coverage, Medicare covers 80 and you're responsible for 20. And so that's a problem, challenge, if you will, that you need to solve. And whether you do Medicare Supplement Plan G or Plan N, or if you do a Medicare Advantage plan, really you're making a financial choice and decision. How do I protect my financial well-being? That's it for today's video. Thank you so much for tuning in. I hope you enjoyed it. If you have questions about Medicare Supplement Plan G, feel free to leave them in the comments below, or you can also reach out to me. Again, I'll leave my phone number and website in the description of this video. If you do like videos like this about Medicare, please subscribe to my YouTube channel, hit the like button, and share it with a friend. Thanks so much for watching. We'll see you in the next one. Have a great day.